All right, our next discussion today is focused on reimagining global health and financing the end of TB. So I want to welcome to the stage now our panel, our esteemed panel and moderator, Jamie Ducharme. He is the health correspondent at Time magazine.
Hello, everyone. My name, as you heard, is Jamie Ducharme. I am a health correspondent at Time magazine, and I'm delighted to be here today moderating this discussion on financing the end of tuberculosis. As many of you likely know, when the United Nations member states set their Sustainable Development Goals in 2015, ending the epidemic of tuberculosis by 2030 was one of the targets that they included. This is a lofty goal. In recent years, according to the World Health Organization, tuberculosis has been the second leading cause of infectious disease deaths worldwide, second only to COVID-19. Around 1.6 million people around the world died of tuberculosis in 2021 alone. But ending the tuberculosis epidemic by 2030 is possible with the right targeted and financed agenda. Here today to talk about what is required to end the burden of TB by 2030 are Dr. Lucica Ditiu, Executive Director of the Stop TB Partnership, Dr. J. Rajda, Head of International Government Health and Payer Engagement at Amazon Web Services, Senator Oluremi Tinubu, First Lady of Nigeria, and Nasser Alkahtani, Executive Director of the Arab Gulf Program for Development. Please join me in welcoming our panel. Now, Dr. Ditiu, I'd love to start with you. The Stop TB Partnership has, of course, been leading this fight for many years. And I would love to begin by talking about some of the innovative strategies for ending TB that you are working towards today.
Yes, thank you so much. And I want to thank you. I want to thank Concordia for offering us this platform to speak about TB. And I'm very happy that in this room there are very few people I know, because usually the TB is discussed between people in the technical groups. So the more people that we don't know in the rooms, the better it is. Because in addition to what Jamie just said, we need to remember that TB is an airborne disease. It's exactly like COVID, spread through air. No country in the world eradicated TB so far, and TB kills more than HIV and malaria together. Still, I imagine that before you entered this room, very few people knew about it or knew about some of these specificities. It's a disease that our parents and grandparents lived with, and it's a disease that we finally have an opportunity to end. We will not be able to go to zero. We will not be able to go even to close to zero, but at least to go to a manageable level that we can be proud of it by the end of 2030. So the disease kills 4,400 people every single day. 700 are children, and it's preventable and curable. So it's a huge task ahead of us. So many of you will be like, why do you think we can end it, and so on? Because there are a lot of tools and approaches ahead of us, and because we try in the TB community to do a few things. The first is we need to use there is a lot of artificial intelligence and digital technology that we are trying to push out there in helping us with the diagnosis, getting quicker and getting closer to people. There is now portable X-ray that can then, after the X-ray is done, send a photo and get the diagnostics with artificial intelligence, things that we couldn't imagine before. We have as well miniaturized the digital tools and the diagnostic tools that can be put in a backpack and basically bring everything closer to people. Because you see in TB, we have a lot of people with vulnerabilities that have a lot of barriers to be able to access diagnosis and care. So the closer we come to them, the better it will be. And we are happy to have here on the stage, we have the First Lady of Nigeria, because Nigeria actually, in the year of 2022, when still fighting with COVID, were able to show that it's possible to do a lot with smartly putting together digital technology and artificial intelligence. The second thing we try to do, this entire reimagining TB care that now becomes reimagining global health, is basically making the tools coming to the front door, coming to your door. We all are a bit reluctant to go to doctors or to go getting tested and diagnosed. The easier you make it for people, especially if they have a vulnerability, the better we'll do. And the third thing that I want to emphasize is, and I'm happy that we have here colleagues from different platforms, is we need to build a strong partnership with industry and with other partners. And traditionally, we forget about that. There is this friction, public sector, advocacy, and then the manufacturers, and then the industry, and so on. This is a collective fight, and we need to bring them because the new innovations need to be put in place and to become available very quickly. That will not be feasible without funding. And my last point is this. We are in an era in which money are very few, right? We have war, we have climate change, we have everything. Everybody is fighting for the attention of the heads of states, of the first ladies, of the ministers of finance for money. We need to be smart. And we need to invest in tools that are actually taking care not just of one disease, of several. So TB is an airborne disease. If you invest into diagnostic multiplexing, we call it, that you have a person that you kind of catch the person in your diagnostic room. You don't do just a test for TB. You do for COVID, you do for other flu, you do for your lungs, you do the blood. So then the person gets a set of tests being done. We need to be smart. Everybody speaks PPPR, is very sexy. Forgot about TB. When COVID came, everybody ran to the TB doctors for taking care of the people with COVID because we deal with the lung diseases. We need to think in the same way for the future. TB is an airborne pandemic. If we invest in diagnostics for TB, we'll help other diseases that are in the lungs. And if we invest into diagnosis and tools for other diseases in the lungs, should help tuberculosis as well. So I will stop here and thank you very much.
Thank you. And to pick up on what you said, Senator Tinubu, Nigeria is a country that deals quite closely with tuberculosis. Could you speak a bit about the role of government and politicians in this fight?
Thank you very much. And speaking with Dr. Ditiu behind the stage, the waiting room, I was able to talk to her about the robust program that the Nigerian government do have. They have the TB, National TB Tuberculosis program domiciled under the Ministry of Health. And the Honorable Minister, they've been working a lot. And with this new administration of the Tinubu administration, the government is promising, to increase budgetary allocation towards health, and I believe that, towards TB as well. And we have a lot of, ailment that we have to grapple with. Tonight we'll be speaking on HIV/AIDS and on a lot of other issues. Like I said, TB is domiciled under leprosy. But, one good thing is not something we shy away from, is, we want our people to live very healthy. And me, as the First Lady, I think with coming out to Concordia this year, I think I'll speak to other First Ladies of states so that we can take the campaign, because most people would not know how contagious it could be. And I was sharing with Dr. Ditiu that I lost a staff of mine, and because he wouldn't talk about it. And the stigma attached to that is really, really damaging, So we have to let people know that, it's like letting people know when you are ill, and then, you talk about it. And I'm also thinking about taking it to schools so that the curricula can embrace, advocacy on that, and we'll see where we go from there. Thank you very much.
Thank you. Such important points to raise. Dr. Rajda, I'd like to go to you next. We've touched a little bit on the role of technology in this. Could you speak a bit about how Amazon Web Services is kind of modernizing this fight against tuberculosis?
Yes, thank you, Jamie, and thank you, Concordia, for the opportunity to be here. It's a great honor to be with this esteemed panel. So one of the challenges with elimination of tuberculosis, as I'm sure you all know, is there remain, out of the 10 million or so cases that are incident every year, approximately 40% remain undetected. And that's problematic because each of these undetected cases can spread tuberculosis in the community to 15 people over the course of a year. And it's particularly challenging because these undetected cases remain heavily concentrated in resource-constrained areas. And really to address that, you think about the resource constraints in these areas. There's a limited number of trained radiologists, for example, to read a chest X-ray. And by the time you get a read back on an X-ray, it takes days, sometimes even weeks to get the read back. And by that time, the patient is lost to follow-up, lost in the community, and may have spread the condition to many people in the community already. So it's critical to make that turnaround process more timely. And that's where technology can play a key role. We have AWS partners like Cure that have developed artificial intelligence technology that can provide point-of-care reads on chest X-rays, eliminating that resource-constrained environment there, and within seconds, use artificial intelligence to using peripheral devices like smartphones or computers can read a chest X-ray, identify abnormalities indicative of tuberculosis, and the patient can be put on treatment within 2 hours. And that's great in not allowing that patient to be lost to follow up in the community. And so these types of technologies require a very powerful and reliable technology platform on which it can be built. It requires high amounts of compute power, low latency, high reliability, and that's where AWS plays a role, is by providing the cloud service to be able to build such solutions at the point of care. Now, these are all of these, this reliable, powerful technology is required in these resource-constrained areas, and so that's what's made available via AWS, enabling the deployment of such technology. There's several other. This is probably the most exciting one. There's other applications as well. There's national scale surveillance and case monitoring. There is information dissemination to citizens, things of that nature as well, where technology can play a huge role.
There is a cough app. There are people developing an app on the phone that you cough on your phone, and then you can predict this TB or so. So wow. A lot of sexy things there. I couldn't contain myself. Sorry.
Thank you. No, that's wonderful to know about. And Mr. Alkahtani, so much of the work that you do at AgFund is based on partnership, on working with people across the world. Could you talk about how important partnership is when you're tackling such an ambitious goal as ending TB?
Yeah, actually, let me just thank you for Concordia for inviting us, and I'm talking after all the distinguished panelists here talking about this kind of disease. We are lucky those days because we have in the platform of SDGs, and SDG 17 goal. Yes, goal number 3 for health, but partnership is a backbone to support this. If we start with partnership in anything, not just the disease, we'll solve the problem, because working together, solving the problem. This is the key, and private sector, government, and civil society is a key. We cannot talk about what we have achieved in AgFund without going back to 1980. That's where the late Prince Talal Abdulaziz was appointed as the first special envoy for UNICEF. He worked too closely with Mr. Grant to encourage government, because at that time the money just came from the government, to help poor country to access to vaccine and treatment and etc. His Royal Highness was appointed at that time for 2 years. You know what after working too closely with Mr. Grant, he raised funds, not just from the Arab region, from Europe and America, more than $80 million, helping to access to vaccine and medicine and etc. While he's doing this, he asked questions. How long it will be, taking me to be a special envoy? They said 2 years. He said, our mission will not be sustainable. So he came up with the idea of creating AgFund. AgFund is the first multilateral fund funding United Nations organization. So when you create AgFund, AgFund took the legacy of His Royal Highness and implement a lot of vision, a lot of idea. So doing during the 80s, if we celebrate during the 90s with Carol Bellamy, announced the health of the child and the woman improve in 90s. That's because of the work. AgFund proud that he worked with the United Nations during the 80s to support women and children. Mid-90s, this is what happened. His Royal Highness concentrate on making a plan when we look at what needed, including health, education, etc. And we see what's needed, what's a priority, what's a challenge, and we start working on the challenge. So the lesson, what we have reached through our work, including helping at the beginning TB, we find out that health cannot be, prevent without primary health care. Primary health care is the key. So without having the primary health care, so that's why Ag Fund is supporting through WHO, supporting country to have trained, people to have access to the best manual, to etc. The second area, what we have learned, localization. Localization is in the medicine. We found out if you localize the medication, that will take the cost down. Imagine today for hepatitis C in Egypt. Egypt now have a zero hepatitis C. The reason, because they localize the medicine. When they have manufacturing the hepatitis medicine, it's become available, and affordable and accessible for everybody. That cut costs down from $1,000 to $50. That became accessible, affordable, and sustainable even by individual, not to wait for the government to pay in his behalf. They could go, and Egypt now is celebrated by the WHO that they have zero hepatitis C. And we hope if we use the same strategy for TB, that's where we could repeat the same thing. Imagine today with COVID-19, as you mentioned, within a year we have vaccine. Why not we have vaccine for others? Because now it's touching everybody. And the problem we're facing today is became global. Ag Fund for the last 40 years working climate change, unemployment, food insecurity. And this is affect health and education, etc. Now it's became affecting everybody. Climate change is, behind everybody. Unemployment is anywhere. Food security. So using technology, I'm glad you mentioned using technology with the direction of His Royal Highness Prince Abdulaziz, the President of Ag Fund. Now we're using technology. This is something not just directly for food security. Now we're doing mapping for agriculture. So we have the map for peanuts, Arabic coffee in Yemen, peanuts in Sudan, and rice in Mauritania. This mapping given us the last 20 years of that area, the production, the kind of production, what is next, even what kind of disease could happen next year, and what kind of medicine. Imagine if something is available those days. Why not being used? Why not being used this technology with this? It took some time, the delay thing, but I hope the regulator those days take the same process they took when they passed the vaccine for COVID-19 and apply for everything if that will help and improve the health of the children and the mother particularly.
Thank you. And with the few minutes left, I want to do a quick little lightning round if I could. So very briefly, I would love to go down the line, starting with you, Senator Tinubu, and just say, with only 7 years to go to reach this goal, what is priority one? Where should we be starting?
I think for us in Nigeria, it has to do with advocacy, working with various community-based organizations, working with civil society, and just to make sure that we can make people to be aware, because most of these people, like I said about stigmatization, people don't like the stigma. They keep it very quiet. So I think to let people know that you can, we talk about the success story, how easy it is to get treated and how easy to get tested. So that is very, very crucial. And I think with me and my other colleagues, first ladies of various states leading the campaign, I think it won't be as bad for people to come out and go get tested. So that would be it. And then the administration is doing a lot with the health sector. And I think funding will be provided. We have a lot of partners also, supporting Nigeria in the fight against tuberculosis. So it's quite good. And we just continue with the fight until we have zero tolerance. So, thank you.
Dr. Rajda.
Yeah, I think very briefly, this is a problem that cannot be solved without technology, just given the large undetected base of disease that continues to remain undetected after many years. So scalable solutions using technology require democratization of access to technology. That's the one key thing that I can highlight that can make a big impact on elimination targets.
Thank you. So I really appreciate what First Lady was actually taking almost what I wanted to say. So we will go back to really try and work together on the advocacy with the other Fourth Ladies. So we heard about technology here. And I'm sorry, I will take something that I think you wanted to say, but I think you should focus on money, because I'm going to say partnerships. I think on the partnerships, money for TB, let me say tuberculosis. So I think the other priority in line here, it's the partnership. And the partnership should go, as Her Excellency said very well, start with the people that are affected. Not for the sake of ticking the box. Very often people invite civil society, communities, TB survivors to say, oh, but we had somebody in the opening. No, should not be there just to tell their story. Should be there to be part of the response. Because as much as we want to develop a response that will fit to their needs, nobody will do it better than themselves for themselves. Right. So a partnership in which they are at the center, but everybody coming around, including the private sector in the industry, of course, the health and the national leaders and the technology and so on, that's what I would put as a priority that we want to speak.
We're just about out of time, but could you finish us off?
Yeah, I would recommend that we go to effective development partnership. Okay, so the effective partnership through localization and use financial inclusion as such, because without having that medication and treatment accessible, affordable and sustainable, it will not solve the problem. At the same time, we need to include people, not just in the financial, in the insurance. Imagine today, if we assess the risk, just that TB, how much is expected that will cost? Let's say 40 billion. We have the option, pay for it, or just pay a premium. So this is the insurance is the solution. But the problem, the insurance is stuck for the rich people, not for the poor people. We want the insurance for everybody, no matter what. Imagine today, I'm telling you example. Imagine today through loan in Jordan, we include insurance against breast cancer. You know how much it costs? $3 a year. Why? Because we insure 100,000 women together. That's $3. Imagine a year. The insurance could solve a lot of things. We have to be innovative, using technology to make the cost low, localize it, not to have hard currency involved, so people could buy the medicine with the same price, not to wait for the next day if the price go up or down. That's it.
Thank you all. Thank you all for being here.